My name is Quincee. I am a two-time cancer survivor. I have leukemia, specifically AML. I'm also a mom of two young girls. One is 6 and one is 2, almost 3. For my career, I am a hairstylist and a makeup artist. So the first time that I got diagnosed, I was pregnant. I was like towards the end of my second trimester. I couldn't really I didn't really know that there was anything wrong per se, but I just knew that I was like really, really tired. And because it was my second pregnancy, I knew that, you get tired when you're pregnant, but I worked all the way through my first pregnancy. So I kind of felt like this one was a little bit different, like the level of fatigue that I was feeling on the day-to-day basis. And then some of the last symptoms that I had before the appointment that I had that kind of let everybody know something was off was like I was starting to have a bunch of spontaneous bruising on my legs and on my hands. And I was starting to have like nosebleeds. My gums would bleed really bad. And it was like some of that stuff is a little bit normal, not the bruising, but like the gums bleeding, the nose bleeding can be normal when you're pregnant. But it was like the amount that I was bleeding was very scary, honestly. And so, yeah, I went to the hematologist and she was just like, okay, let's run some tests. And I, had my appointment. I left for the day and they were like blowing my phone up like, they called me about, 3 times, including the actual doctor, which now I know if the doctor calls you, it's probably not the best news because they don't usually call people, they don't usually have the time to sit on the phone and talk to people, and, they were, like, begging me to come back up to the hospital to get a blood transfusion because my blood levels were so low, and they were really dangerously low, so, yeah, it was kind of a scary time. The second time was a lot less dramatic. It was just a routine bone marrow biopsy follow-up after my 2-year transplant, and, they just found, some residual cancer cells, and they were like, "Hey, we think you might be relapsing." So that one was a lot less dramatic. The first time was a lot scarier for sure, especially because I was pregnant. I don't think I even processed it for a while because everything kind of happened really fast. I found out that I had cancer, and it wasn't even like a big meeting because the whole time from the time that I was told that I needed to go back to the hospital to get the blood transfusions up until the time that I was told that I had cancer, it was like a week, and that whole week I was in the hospital, and I was pretty much by myself because, my boyfriend had to stay with our younger daughter. He couldn't just leave her by herself and come be with me or anything like that. So, by the time they told me that I had cancer, within I would say like 8 hours, they were transferring me over to a hospital in a different city at UW, and I didn't really have time to process what was going on. I don't feel like I had time to process what was going on until I started my chemo about 2 weeks later, maybe even like 3 weeks later when I was like in the hospital by myself. I wasn't allowed to have visitors because it was COVID and there was no vaccine at the time. And I just was spending a lot of time by myself, and I just remember sitting in my bed like, "Oh my gosh, I really have cancer, like, I'm really sitting here all alone," and the only comfort that I had was my baby kicking in my belly and stuff. Everything hurts. I look like shit. I'm getting some peach fuzz. My hair's growing back. That's awesome. I love that for me. The main thing that I think would have been different if I wasn't pregnant was the speed at which they would have started my chemo. They probably would have started chemo with me like the next day or like within 2 days versus they had me wait about 2 weeks because they wanted to make sure that the bone marrow biopsy results were exactly what they thought they were. They had to they didn't repeat a bone marrow biopsy, but they reran the test just to make sure that the typing was correct and that they knew exactly what chemo to give me. And they really, really took their time figuring out a treatment plan because I was pregnant and they had to make sure that whatever they were giving me was going to be safe for the baby because at that point it was still too early for me to deliver because I was only 28 weeks. I had just turned 28 weeks. Um, And so she would have been too small to deliver, and it was a little too up in the air if she would have been healthy. And they had to give me chemo because I just wasn't able to sustain just on blood transfusions alone. I was needing to get them every other day at that point. For me personally, I probably wish that I would have known that I would be pretty sick. Like, I kind of just thought that chemo was like, you get it injected and maybe you feel tired and maybe you need to sleep a lot more. But I just wasn't expecting how sick I would feel throughout the process. And I also wasn't expecting to feel so sick for as long as I do. Like, I thought it was like something that would wear off after a couple of days. I didn't realize it was something, at least for the type of chemo that I got as a leukemia patient, your blood counts drop down to zero, and I wasn't expecting to feel so bad until they came back up, which can take like 4 weeks. The first night, the side effect, I like spiked a fever and I think I was like throwing up. And other than that, I didn't have any like crazy side effects. I wasn't super nauseous, but I did get some pretty bad mucositis. My I wasn't exactly having like sores on my gums, but my gums became like really, really inflamed and swollen to where it was like actually hard for me to talk. And the only thing that you can do with that is like the magic mouthwash and swishing around the salt water. Other than that, I would have a lot of brain fog and just really tired, lost my hair, but other than that, nothing like too crazy like some other chemos that have had some other crazy reactions. I did one chemo treatment while I was pregnant, and then I took a break, a little bit longer than what they like to do when you have AML. I took like a 6 or 7 week break, maybe even like an 8 week break between my two chemos to have my baby and to give me a little bit of time to like heal my body before doing my second treatment when I wasn't pregnant. It is April 6th at 8:57, 8:58, and I'm getting ready to have this little baby. She's in here somewhere. I started my second treatment about 10 days after giving birth, which wasn't very much time to heal at all, but I had already stretched out my treatment so far at that point that they weren't comfortable waiting any longer, because I still had residual cancer cells. So then I had the second treatment. The second treatment put me into remission. So then I had to do like a maintenance chemo just to keep me in remission because I had a little bit of a lull between the second chemo and when I was going to get my transplant. And then once I started the transplant process, I had a 3-day chemo and then I had 8 rounds of radiation, total body radiation, which they were 2 a days. So it was only 4 days, but I was getting one in the morning, one in the afternoon. And that was so hard. That was probably the hardest, like, I would say that the radiation, because I had to get a lot of radiation, it was probably the hardest treatment that I've had to this day. Like, even now, relapsing, like, that one was absolutely awful. But then I got my transplant, and then I was pretty much done with anything like treatment related, and everything from there was just like medicine and stuff. Look, our best bet is to take a boat across the bay at dawn. I can say in hindsight, I probably didn't ask the right questions because I felt like it was a little hard for me to like research the type of radiation that I was getting because a lot of radiation stories that you hear about is more targeted, whereas I was getting total body radiation, which is very different. Like you don't have like the burning or anything like that that a lot of people that are getting targeted radiation experience, but you do I would say you probably feel a lot sicker because it's all over the place instead of it just being localized and you having one area of your body that is, being targeted. It's everywhere. And so you feel very sick. And I didn't realize how much, like, they told me I was getting a lot of radiation, but I didn't realize exactly how much radiation I was getting until after the fact. And they basically were like, yeah, if you wouldn't have gotten a transplant, you would have died because you had so much radiation in your body. It wouldn't have been, you wouldn't have been able to live through it. And the only reason why you were able to is because you had the transplant. And I was like, well, I mean, at the time it worked and the cancer was gone, but now I'm like, was it really worth it because the cancer came back? Which I know probably shouldn't laugh at that, but it's kind of hard not to. So I had a cord the first time I had a cord blood transplant, which is like they just take stem cells from an umbilical cord, like a donated umbilical cord. Mine was unrelated donor. And I was a part of a clinical trial where they were trying to basically make it to where they didn't need two what are they called? Two umbilical cords. They could like expand the cells from one umbilical cord and only need one so that you would have less chance of graft versus host disease. After my first transplant, the first year I would say was pretty difficult because I got pretty sick. I would say when you get a transplant from an umbilical cord, you're dealing with like a newborn baby's immune system who hasn't had a cold before, who hasn't had the flu before, who doesn't have like antibodies to fight any of this stuff. So I got sick pretty much every single time my kids came home with something. I got sick as well because I would always laugh and joke and say, "Oh my gosh, my newborn daughter's immune system is stronger than mine because she was technically 2 months older than me, you know? Like she was about 3 months older than I was." So me and her would usually get sick around the same time with pretty much the same things because we both just had really weak immune systems. So the first year I had pneumonia a few times, a lot of colds. I think I had the flu once. Not very fun. But then after the first year, the second year was pretty good and I didn't really experience that much. And I honestly didn't even feel like I was relapsing when I found out that I was relapsing. Like I was feeling pretty good and pretty like strong and like almost like back at my baseline of pre-cancer. But I wanted to get a they told me I didn't need to, but I just wanted to have peace of mind. And so I was like, okay, I would prefer if I get another bone marrow biopsy done because I just want to know for sure that the cancer's gone and I don't have anything to worry about. And I'm happy that I did because I probably wouldn't have known that it was coming until it was like way more progressed. They found it when it was less than 1%. So that was good. The treatment plan was a little different. They wanted to try a different drug. So I was getting like a regular chemo, like IV chemo, and then I also had to get like a chemo pill on top of it. And so I did that twice. And then after the 2 rounds of chemo, I was planned to get my transplant, which I got last month in February. I got in the beginning of February. And then because of how much radiation I had the first time, I was unable to get that much radiation. I had like one, I want to say I did 1 day of radiation. It was like significantly less. I forgot what they're called. They're like gray, I think is what the term is for the level of radiation they give you, but it was like significantly less than what I had the first time. I also did chemo with that one as well, but it wasn't as intense, but I would say maybe my body just having a little bit more of a tolerance to the chemo, I would say some of the side effects were a little bit worse. Like I felt like I got sicker this time around than I did the first time around. The first round of chemo, the second time after relapsing was like I want to say I had gotten like a cold or I got like the flu or like a bacterial infection or something like that. Maybe like 3 days after leaving the hospital. It was kind of annoying because I like left the hospital, was like really excited, and then ended up going right back. And then the second round of chemo, I got like a staph infection, a staphylococcus infection, and that one was absolutely horrible. And then that turned into I had another like staph infection like in my skin. I would say I just kept getting a lot of infections, which I don't remember having quite as many infections after my first rounds of chemo. The first time around, I would have like rashes, like breakout in rashes and have like neutropenic fevers, but I was having like actual infections the second time around, which was a lot harder. I would definitely say that I think it's really important to make sure that you have a focus on something that is not centered around you having cancer and you being sick. I think that helped me a lot the first time, especially because I was pregnant. Like, the only thing my mind could really focus on was like baby. Everything was about baby. Like, even though I was in the hospital by myself, I didn't really, I'm not going to say I didn't care because obviously it wasn't fun, but it just, my mind couldn't even focus on the fact that I was sick for too long because I had to think happy thoughts because I'm like, okay, I'm creating another human life. I have to make sure that this human life is going to be happy and healthy. I definitely always tell people that you have to take your health seriously. And if something feels off, there probably is something off. I just think back to that time when I was pregnant and I started to notice the bruising, which coincidentally, I noticed it about a week before I saw the hematologist, which was already a scheduled appointment that I was already going to have. And so I saw the bruising and I remember like telling her like, "Yeah, I'm starting to have bruises everywhere." And I remember like she wasn't going to check, but I was like, "Can we just look at my legs cuz I don't there's no pain. I didn't hit myself, because it's really easy for someone to say, "Oh, maybe you just hit your leg on the couch or maybe you bumped into something, a table." But no, I knew something was off and I kind of had to press a little bit, but then it ended up working out in my favor. Obviously, having cancer wasn't in my favor, but it being found when it was found is much better than nothing happening and then me going into labor and things going completely different because I don't have the blood cells to have a baby, you know?